Does the board know the total patient harm rate for the past year or past quarter? What are your organization's biggest strategies to reduce patient harm?
As trustees of healthcare organizations with missions to improve the health of our communities, measuring and eliminating patient harm is a critical role and responsibility for all of us. What do we mean by patient harm? Well, we know there are a number of important areas where the science, the evidence, the clinical best practice is known. And we have examples of hospitals around the country that have eliminated patient harm in those areas. Patient harm composite is an aggregation of known patient safety indicators. So adverse drug events, infections, and patient falls, and those are examples of how you aggregate to get to a patient harm. So as trustees, our role, our critical responsibility is to ensure that we have a patient harm composite metric that we're looking at for our hospitals, tracking on a monthly basis and identifying improvement part. The second related to not just measuring, not just tracking, is having the conversation at the boardroom about what are our strategies organization-wide to eliminate patient harm. What are we doing, not just in our specific infection topics and our pressure ulcers, which are all important, but what are we doing across the organization? What are our patient and family engagement strategies to engage patients and families in these processes? What are our leadership incentives and alignment to make eliminating patient harm a central focus? What are our data and information needs that we have so that we can feed data back to our frontline clinicians so that they know how we can eliminate patient harm?
Harm across the board is a concept that's been generated within the last year to kind of unify all the different improvement activities under a common concept. And I think it is a powerful concept because it is really what patients expect. I mean, when they go to the hospital, they don't expect to be protected just from a central line infection or MRSA. They really hope and expect the hospital to be safe across the board. So when you do invest in preventing harm across the board or achieving safety across the board, it takes a systems approach to do it. So it's indicative of a hospital that's really invested in that systems approach. The key thing about harm across the board is that it does roll up a number of different metrics. So into something that does tell the story of an organization's commitment to an investment in safety. So again, rather than focusing on CAUTI or a particular issue, you kind of see it in a context, a bigger context, a deeper context of what the overall mission is. Because we'll make progress, we'll eliminate certain things, and then we'll find new things that we want to be paying attention to. So it just kind of integrates that all into not only a concept, but a way of putting your metrics together into something that makes sense.
As trustees, we look at a number of important quality and patient safety indicators, and they're all critical for us to track, to know how progress is going, and to identify strategies for improvement.
The root of the word governance is a Latin root that means to steer. As you steer a ship, you generally only need two things to navigate: a watch and a star. Well, healthcare organizations have a lot more quality data than 2 points. It's clear that 60 or 70 points may be way too much for a board to help steer the quality ship of the organization. Boards should concentrate on identifying 5, 6, or 7 key metrics around quality to help them guide the organization's performance. Being overwhelmed with data can be just as ineffective as having too little data about quality.
It is so important that we all know what is our patient harm rate in this hospital or health system, and how are we doing month by month, and how do we eliminate patient harm. So our role as trustees is, one, to have that metric, to ensure that it's reliable and it's reflecting all the important elements of the Partnership for Patients campaign and the Hospital Engagement Network. And then it's to track and to find improvements, and most importantly, as trustees, for us to think about the organizational-wide strategies to help us eliminate patient harm. So it's so critical as trustees for us to, one, again, have that metric, make it a composite, talk about that at our board meetings. So energizing, so important for us as trustees to go around the room and say, for example, last month we may have had 12 patients harmed. 2 might have been surgical site infections, 4 might have been adverse drug events, 2 might have been early elective deliveries. But it allows us to elevate the conversation to what can we do to eliminate harm for our patients. Then we need to track it on an ongoing basis, and we encourage you to look at eliminating harm across the board. Use the harm across the board template as a way to track harm month by month, and then to have the conversation about what are our organizational-wide strategies that will help us do there. And there are a number of them. Patient and family engagement is such a critical one. Do you have the right strategies in place to engage patients and families to reducing harm? Engage them in the conversation about hand hygiene, about how to prevent falls, and how to be engaged in terms of the care. Do you have the right strategies around data and tracking of the information and feedback of the information to your providers? Do you have the right strategies around leadership engagement and aligning incentives to doing the right thing about eliminating harm across the board? So those are some of the strategies as you as trustees, as all of us, as healthcare leaders, look to measure a composite on patient harm and then eliminate patient harm.
We have a quality pillar in there that we've gone on so that we do have quality metrics. We have, of course, the core metrics that we do, but we also have success sharing goals that always have quality, and we try to look at ones that we feel that everybody across the organization can help impact. Readmissions was one of those. Hand washing is another one. Falls is one of those. So because even the dietary person that's delivering a tray can tell someone's side rail's down because we have a color. Everybody wears yellow wristbands. They have yellow booties on. We put yellow on the door if they're a fall risk. So we want to make sure that we've got quality metrics even for success sharing across the organization.
So as board members, we have 3 important roles here. Number 1 is to measure patient harm composite. We have a role to ensure that all our indicators roll up so we can high-level discussion about patient harm. 2 is to track it on a monthly basis, so we know month to month how are we doing in terms of eliminating patient harm. And 3 is to have the organizational-wide strategy discussion about how do we eliminate patient harm. It's important to know what we can do in infections and what we can do in patient falls, but it's also important as trustees to talk about what are those organizational-wide strategies, like patient and family engagement, that are essential to eliminating patient harm. How do we leverage that across all our harm topics? So as board members, have the measure, track the measure, and discuss the strategic ways to eliminate patient harm. And using the harm across the board template is a great way to know how you're doing and to track and to really get to 0 in terms of harm.
It is all about the patient. In the end, boards, management, medical staff are all to be united in making sure that we do the right thing at the right time and the right way every day for the patients we're called to serve.
Hospitals must be tracking and collecting reliable quality and patient safety metrics on a monthly basis and then sharing them with the board. Boards must ensure that metrics are aggregated into the organization's overall patient harm composite rate. Boards must play an active role in identifying major organization-wide strategies to eliminate patient harm.